Let me paint you a picture. You're 74 years old. You feel great, you're sleeping well, your energy is decent, you're doing things you enjoy. You go in for your annual physical routine, nothing special. Your doctor glances at your chart and says, "You know what? Let's run a few tests just to be safe." 6 weeks later, you're sitting in a surgeon's office, not because anything was wrong with you, but because those just to be safe tests found something. And that something set off a chain of events that your body 74 was not equipped to handle. And now the life you were quietly enjoying, it looks very different. That exact story plays out more often than the medical system likes to admit, and the data behind it deserves a serious conversation. My name is Dr. Franklin, and this channel is dedicated to one thing: helping adults over 60 understand what the research actually says about their health in plain language. And what I'm about to share doesn't come from a single textbook. It comes from years of studying the medical literature and paying close attention to what the evidence shows when the system runs on autopilot. Here's the truth that most doctors won't say out loud in a 15-minute appointment. After the age of 70, some of the most common routine medical tests can cause more harm than good. Not because medicine is broken, but because the risk-to-benefit math changes dramatically as we age. And nobody is doing that math in the room with you. Today, I'm walking you through 5 specific medical checkups I would personally reconsider after 70. I'll tell you why the math changes, I'll share what I've seen happen to real patients, and at the end, I'll give you a set of questions that will completely change the dynamic in your next doctor's appointment. Stay with me through all 5. Because number 3 has stopped many people in their tracks when they first hear it. And number 5 is the one that most people have never even heard of until it's too late. Before we get into this, I'd love to hear from you. Where are you watching from today? Drop your city or country in the comments. I read every single one, and it really helps me see who's part of this community. All right, let's get started. Before we get into the 5 checkups, I need to give you one concept because without it, nothing I'm about to say will fully make sense. I call it the longevity lens. When you're 50, screening medicine works beautifully. You find a problem early, you treat it, and you potentially buy yourself 30 more years of healthy life. The investment is worth it. The math is clean. But here's what changes after 70. 3 things specifically. First, many conditions detected by routine screening in older adults will never actually harm you. They grow slowly, they cause no symptoms, you will likely outlive them. But once they show up on a report, medicine doesn't have a leave it alone and watch button. It has a treatment button. Second, your body's tolerance for intervention drops with age. The surgery that a 55-year-old bounces back from in 2 weeks, that same surgery in a 78-year-old can mean months of recovery, complications, loss of independence, or worse. Third, there is something called the cascade effect. One test finds a small abnormality. That triggers a follow-up scan. The scan recommends a biopsy. The biopsy leads to a procedure. The procedure causes a complication. And suddenly, a person who walked in feeling perfectly healthy is navigating a medical nightmare. All started by a test they didn't need. That's the longevity lens. Keep it in your mind as we go through each one. Before we begin, take a second and tell me your name and where you're tuning in from. I go through the comments and I genuinely want to know who I'm speaking to and supporting here. Checkup number 1, routine colonoscopy after age 75. Let me tell you about Dorothy. Dorothy was 77 years old, a retired librarian from rural Tennessee. She'd had 2 colonoscopies in her 50s and 60s, both completely clean. No polyps, no family history of colon cancer, no symptoms whatsoever. But her new primary care doctor looked at her chart and said she was due for another one. Dorothy did her research. She had concerns, but she didn't want to seem difficult, so she went. The prep, the liquid you have to drink the night before to clear your bowels, hit her kidneys hard. By the next morning, she was confused, dizzy, and barely able to stand. Her daughter rushed her to the emergency room before she ever made it to the procedure. She was severely dehydrated, and her electrolytes were so dangerously low, her heart was at risk. Dorothy spent 4 days in the hospital. She never had the colonoscopy. And the irony, she didn't need it. The United States Preventive Services Task Force The gold standard body that sets screening guidelines in this country officially recommends against routine colonoscopy screening for average-risk adults over the age of 75. The evidence is clear. After 75, if you have no symptoms, no family history, and clean previous scopes, the risks begin to outweigh the rewards. And those risks are real. Bowel perforation, a literal tear in your colon, occurs in approximately 1 in every 500 colonoscopies. In a younger adult, that's a manageable surgical complication. In a 77-year-old, it can mean emergency surgery, a colostomy bag, extended hospitalization, and a recovery that fundamentally changes your quality of life. Meanwhile, the colon cancers most likely to be found in asymptomatic older adults tend to grow slowly enough that in many cases they would never cause problems in a person's remaining lifetime. What to do instead? Ask your doctor about a non-invasive stool-based test like the Cologuard or annual FIT test. These can flag genuine warning signs without the procedural risks, and if you do have symptoms, blood in your stool, unexplained changes in bowel habits, that changes the equation entirely. See your doctor. Checkup number 2, aggressive PSA prostate testing and annual mammography for low-risk patients. Let me be very precise here because this topic deserves nuance. I am not saying never check for cancer. Cancer screening has saved millions of lives and it can absolutely save yours. What I am saying is this: after 75, aggressive cancer screening in average-risk, asymptomatic individuals has a serious overdiagnosis problem. And overdiagnosis leads directly to overtreatment. Here's what overdiagnosis means in plain language. Imaging technology today is so sensitive that it can detect cancers that are, biologically speaking, barely awake. Tiny, slow-growing tumors that, left alone, would never spread, never cause a symptom, and never shorten your life. You would die with them, not from them. But the moment a radiologist writes the word malignancy on a report, the clinical machine turns on. Biopsies, specialist referrals, treatment decisions, all of it moves forward regardless of whether the cancer actually poses a threat to you. Consider a case like Richard's, a 79-year-old retired mechanic from Georgia, sharp, independent, still fishing on weekends. Routine PSA came back slightly elevated. Biopsy confirmed a low-grade, slow-moving prostate cancer. His urologist recommended radiation therapy. Richard trusted the recommendation. He went through treatment. Within a year, he was dealing with chronic fatigue, urinary problems, and a quality of life that had dropped dramatically. Stories like his are documented across the medical literature. Men who, looking back, wished they'd understood that their cancer was the kind a man his age would almost certainly have lived alongside, not died from. That knowledge, had it come earlier, might have changed everything. Studies in the New England Journal of Medicine found that a substantial portion of cancers detected through mammography in women over 70 were clinically insignificant, meaning treatment offered no survival benefit, only side effects. What to do instead? Have an honest conversation with your doctor about your specific risk profile. If you have a family history, genetic markers, or symptoms, screen. If you're average risk with no symptoms, ask your doctor directly. If we find something, what are the realistic treatment options at my age, and what would we likely recommend? That question alone often changes the conversation. If you're still here with me and finding this helpful, take a moment to type 2 in the comments. It lets me know you're watching and getting value from this. Checkup number 3, routine cardiac stress testing without symptoms. This one surprises people because it sounds so logical. Your doctor says, "You're 72. Let's just make sure your heart is doing okay." You hop on a treadmill, or they give you a medication that temporarily stresses your heart and monitor the response. Sounds benign, sounds responsible. Here's the problem. Cardiac stress tests in people without symptoms have false positive rates that can reach 40% or higher in certain populations. That means nearly half the time, the test flags an abnormality when your heart is actually fine. But medicine can't just shrug at an abnormal finding. That false alarm launches you into the next phase, a cardiac catheterization. Catheterization means threading a thin tube through your blood vessels, typically through your wrist or groin, directly into your heart. It's a serious procedure. Risks include bleeding, vessel damage, arrhythmia, and in rare cases, it can trigger the very heart attack or stroke you were trying to prevent. And here's where it gets even more counterintuitive. If the catheterization finds a partial blockage, which is extremely common in adults over 70, many of whom have no symptoms whatsoever, you may end up with a cardiac stent. Multiple landmark clinical trials, including the widely cited ischemia trial, found that stenting in patients with stable coronary artery disease did not reduce heart attacks or extend life compared to medication and lifestyle management alone. Let me say that again, the stent didn't help more than the medication, but it carried real risks of its own, and then a